The Better Regulation for Better Health project comes really from EFA's historical work on better regulation. So this has been going on since the mid 2000s, led by former Secretary Generals and various people within the Secretariat. Better regulation's naturally not at the front and centre of public health agendas or advocacy strategies for organisations like EFA or like EFA's members. And that, I think, is because it feels quite vague, it feels quite abstract, it's not directly linked to any specific public health issue or disease or legislative file for that matter. So it maybe feels like it's a little bit further away from the day-to-day activities that organisations like EFA are involved in. I would add that that's true in the public health sphere. It's also true more widely across environmental and labour and social policy NGOs. There are plenty of civil society organisations that are aware of better regulation and the agenda itself, but that don't work on it in any real central sustained manner, because for everybody it's this sort of slightly outside of the everyday vague agenda, if you like. So that was really at the core of when we were developing the Better Regulation for Better Health project. We were really keen to have a work stream that involved capacity building with civil society. We've run a few events as part of the project, and then at the very centre of that was the development of a civil society toolkit. So in practical terms, better regulation is essentially a two-part handbook, if you like. The first part is a set of better regulation guidelines, and these tell us what it is that EU policy should achieve overall, what its aims and objectives are, how it should be structured, the three pillars that it should rest on. So this idea of being evidence-based, of including participation with stakeholders and those that are affected by policy, and the idea that it should reduce burden. So the guidelines are very much the overarching part of the handbook. The second part of the handbook is a 600-page document that is essentially a manual for policymakers. It tells them how each stage of the process should go, when they have to seek validation and political support for things that they want to do, how they should conduct an impact assessment, how they should design a consultation strategy and who they should consult as part of that process, how evaluation should be conducted, and all of the sort of detailed techniques and models and approaches that should be used as part of the policy development process. So it's really the manual, if you like, of EU policy making. It applies across all sectors, of course, not just health, but if we want to understand how health policy is made, it's really not possible to do that unless we also understand the handbook that informs that process. So President von der Leyen's introduced some new elements, and she's revised some existing elements of the better regulation framework. Most recently, that has been to do with aligning with the new competitiveness agenda at EU level. So a couple of things that are of particular importance here. One is the one in, one out approach, which will require policymakers to offset the burdens that are created by new laws by reducing those burdens elsewhere. Another is this provision that we see to stress test the entire body of EU law. With both of these, it's not especially clear how those will work in practice. They've only been recently announced, but particularly with the stress testing, there's a real possibility here of opening up a lot of regulations and legislation that has already been agreed and reviewing in that process, which will of course involve the lobbying and the corporate activity that we've seen in the past. We're also expecting a new interinstitutional agreement under the new Commission, so that will increase the focus of all of the EU institutions on better regulation, also on the simplification agenda, which we see included in the mission letters for all of the new commissioners. And we also see within that the introduction of a new consultation approach called reality checks. Again, not 100% clear what that's going to involve in practice, but it seems to focus on handpicking a certain set of stakeholders for closer engagement in the early stages of the policy process with Commission officials. So that's something we'll also want to keep an eye on. The details of many of these documents are still quite vague, but they're all going to be really important to the way in which health policy is developed, the context in which health policy is developed, and they're going to need our attention in the coming months and years.